Hi, my name is Janet Chesnick, and I'm an LPN and a student nurse. I am currently working on my RN and BSN from Indiana State University. This video is part of a series of 7 videos that I am making for my Community Health Nursing 444 class. I also work as a triage nurse for a pediatric primary care office. Each video will discuss a different topic that I am asked frequently about as a pediatric triage nurse. The population at risk that I'm addressing is pediatric patients and their parents. Before I begin, I do want to emphasize that this video is informational, but in no way should replace consulting with your own pediatrician. And one of the more common topics that parents ask me about is speech delays. So it's important for a parent to know what is normal speech development for their child, how to encourage speech development, and when to ask for help. These are the learning objectives for this video. Normal speech development for a baby, toddler speech development, normal speech for a preschooler, school-age children and speech concerns, when to be concerned, and what happens when there is a problem. Attached to this video is a pre and post test to quiz yourself, as well as a handout with links to find out more. So this would be a good point to stop the video and do the pre-quiz if you're interested in doing that. Otherwise, let's get started. So what is the normal speech development of a baby? There's 2 parts to speech development. 1 is making the sounds and words, and 2 is communicating ideas. And these are both important. So when it comes to making sounds and words, babies will begin by 3 months old making cooing sounds, kind of exploring with their mouth the different sounds that they can make. There's no real communication there. That's them really just kind of playing with what their mouth can do. By around 9 months old, they may start to imitate some of the sounds that they hear others make. So if you say ba ba ba, they might say ba 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 back. Doesn't necessarily mean they understand what that means. They are just imitating the sound. By 12 months, they will actually start to put a few syllables together to represent some ideas. So for example, baba for bottle, or mama or dada. They won't have a lot of words, but they will definitely have a few sounds that are definitely representative of words by a year old. Now, that comes to the concept of communicating ideas. So the first way they communicate is by crying, and they will have different cries depending on their needs. So as you get to know your baby, you will be able to tell what's a hungry cry, what's a cry for pain, or what's a cry just because they're fussy and just not, in general, not happy. By 3 months old, they will begin smiling and responding to your voice. And around 9 months old, they'll start pointing and gesturing, like waving bye-bye, things like that. And then again, by 12 months old, there should definitely be some very purposeful syllables that are representing some words. So what is the normal speech development for a toddler? Well, like we said before, they should have a few syllables by the time they're 12 months old that represent words. And by the time they're 2, those words will have grown up to around 50 words. Now, these are words that they can actually say. They will actually understand a lot more words. By the time they're 2 years old, they will actually be starting to put a couple words together to make these 2 to 3 word sentences. Now, because they're really using syllables and not clear words in language like we adults use, 50% of what they say should be able to be understood by the time they're 2 years old. Sometimes parents can understand more because they're around them. but definitely by the time they're 2, other people outside of the parent should start to understand what they're trying to communicate. They also, around that 1 to 2 years of age, start to understand simple commands like come here, put that down, and they will, of course, understand way more words than what they are actually using themselves. Normal speech for a preschooler, by the time they're 3, 4 years old, 75% of what they say should be able to be understood. They'll be able to ask for things, answer simple questions, and talk about the experiences, people, and things in simple terms like their friends. By 4 years old, they should be using sentences that have 4 to 5 words. And by 5 years old, they should be able to say most of their sounds correctly. There will be a few that some 5-year-olds still struggle with, but most of their sounds should be clear. Children that are in a bilingual home with more than one language spoken, they could just be catching up at this point. Sometimes parents get concerned that their children are behind because they speak more than one language, and then around this age they suddenly catch up in both languages. So what about older children and their speech concerns? Once your child is in school, there's still things you want to keep an eye out for. They should be able to follow multi-step directions. They should be able to listen to stories and communicate about what they heard. They should be learning to use grammar correctly. They should be able to participate properly in conversations and stay on topic. They should be learning to participate in group discussions and then learning, of course, how to give a presentation. So when should you be concerned? If you're concerned that your child is not meeting milestones, they're not doing things by the average age that children are normally doing those, it's definitely time to talk to your doctor. If your child seems to not want to make eye contact when they're communicating, it's another reason to talk to your doctor. Or if your child is making repetitive sounds instead of words, like they're really struggling to get the words out and they're starting to stutter, you definitely would like to speak to your doctor about those concerns. So what if there is a problem? So if you go to talk to your doctor, they have different developmental screens that they can use depending on the child's age. There's ASQs, which are general developmental screens, not only for speech, but for also other developmental concerns. And then there's also the MChat, which is actually specifically for autism. And on the slide here, you have a portion of the MChat, and that is free to look up online. And it's just a series of yes or no questions. If your provider decides that there is a concern, your child might need to see a speech therapist in order to get on track. So this could be something that's done at your home, at an outpatient setting, or for school-age child, could be done at school. There are local programs such as First Steps and also developmental preschool programs, as well as elementary school programs that can help as well. This is my list of references. These are also really good websites to check out. A lot of these websites are information that I have actually given to parents to check out when they've called my office. Some of them have good handouts that when the parents are in office, we give them. And of course, if there are autism concerns, we definitely use the MChat. So if you see any of the concerning symptoms that are discussed in this video, or you have more questions about your child's health, you should definitely consult your pediatrician. As a new parent, you're going to become accustomed to what's normal for your child. So if there are some changes and you're not sure if it's normal or not, definitely call your doctor. I have attached a handout to this video that'll have some more information as well as a post quiz. So thanks for watching. I hope you found it informative and enjoyed the pictures of my children.